what actually happens during a tilt table test?
So actually on a tilt test, the first thing we do is that we get the patient strapped into a table, and which is lying horizontally. And then we need to set up a very sophisticated equipment on their wrists. And what the equipment does is to measure your blood pressure with every single heartbeat. So your normal blood pressure machine will take about, say, 2-3 minutes to measure your blood pressure once. Now, this special machine will measure your blood pressure 60 times or more a minute. And so over a course of, let's say, half an hour, it will measure your blood pressure thousands of times. And so this is very, very important because we want to look for minor changes in blood pressure, which we wouldn't be able to do any other way. So once that machine is set up, then we will ask the patient to stand for at least 30 minutes. So the table will automatically come up. And then we will observe the changes in blood pressure over that period of time. If needed, after 30 minutes, we may ask the patient to do some actions, or we may give them a medication under the tongue, and this is to further challenge their body to maintain normal blood pressure and normal heart rate.
How long does a tilt table test take?
So the setup probably takes about 10-15 minutes. Then the patient has to stand for half an hour, and then there's a little bit after that for any medication or any maneuvers that we want to do. So probably an hour is reasonable total time for the test.
Will I faint during the test?
So some patients will faint during the test. I would say probably about 50% of patients will faint during the test. In some ways, the fainting can be perceived as a good thing because the patients don't understand why they faint. They are also scared that the fainting may be caused by a dangerous condition. So by being able to simulate their faints in a controlled environment, we're able to make the diagnosis and also reassure patients that we understand why they faint. So yes, 50% of patients do faint, but the fainting is usually very, very short. It usually lasts for only a few seconds because once we lower the table, the fainting episode will end immediately.